The NBA is a physically demanding sport, which puts its players at risk of cuts and abrasions on the court. While minor cuts and abrasions are common, more serious injuries such as lacerations and open wounds can occur. These injuries require prompt medical attention to stop the bleeding, reduce the risk of infection, and promote healing. To prevent and manage these types of injuries, NBA players take a number of steps to stop the bleeding and promote healing. Here's what NBA players do to stop the bleeding. 1. Apply pressure. Applying direct pressure to the wound is one of the most effective ways to stop bleeding. Applying pressure with a clean cloth or paper towel is the first step to take. If the bleeding doesn't stop, the player may need to use a tourniquet to completely stop the bleeding. 2. Clean the wound. It's important to clean the wound with an antiseptic solution or saline solution. This helps reduce the risk of infection and further bleeding. 3. Use a bandage. Applying a sterile bandage to the wound is important to protect the wound from further injury and to help keep the wound clean. 4. Seek medical attention. Regardless of the severity of the injury, it's important to seek medical attention to ensure the wound is properly cleaned and treated. The above steps are important to take to stop bleeding and promote healing. However, it's also important for NBA players to take preventative measures, such as wearing protective gear and using proper technique, to reduce the risk of injuries. Taking the proper steps to prevent and manage injuries can help NBA players stay healthy and on the court.